In a significant development aimed at strengthening healthcare in West Africa, Georgetown University, with funding from the United States Centers for Disease Control and Prevention, is set to launch the Public Health Emergency Preparedness, Response and Recovery Fellowship. A two-day program on the needs assessment for the development of the fellowship is ongoing in Abuja, Nigeria's capital. In his address, the Director General, Nigeria Center for Disease Control, Dr. Ifedayo Adetifa, welcomed the idea of a Public Health Emergency Response and Recovery Fellowship as a means to contribute to further health security and public health workforce strengthening. Dr. Adetifa noted that the vision is for the fellowship program to develop a robust curriculum and be instrumental in shaping the landscape of health security and public health workforce capacity at all levels in the country.
We welcome the idea of a Public Health Emergency Preparedness and Response and Recovery Fellowship as a means to contribute to further health security or public health workforce strengthening. And I am sure that colleagues who are visiting from the region will appreciate the need for this, given some of the threats that we have faced over the years, be it the West African Ebola outbreak or more recently COVID, and in between Lassa fever, Mpox and everything else, cholera.
Dr. Kirtan Victory, the West Africa Regional Advisor for the US-CDC, emphasized the pressing regional needs to bolster emergency preparedness and response capabilities across West Africa. He explained that the imperative involves cultivating a diverse workforce capable of effectively addressing both current and future infections disease threats within the sub-region.
As we have mentioned, there is need regionally to strengthen emergency preparedness and response surge capacity in the region. That's building a diverse workforce to be able to respond to current and future infectious disease threats in the region.
The field resident director at Georgetown University, Assistant Professor Ibrahim Gubir, stated that the aim of the fellowship was to ensure preparedness and quick response to diseases and epidemics.
Cast your mind back to when we had COVID and imagine how all of the countries have to work together. You are just not doing stuff at a local level alone. You have to move on to that high level. You have to coordinate with international bodies. That's the level that we are looking at, and that's exactly how we want all of us to think as we continue to articulate our thoughts around how we really want to set the stage for the PHEPRR fellowship itself. I want us to just think about the 3 R's, or what I try to summarize as the 3 R's, which is reframe, reimagine, and resolve. What is reframing? And I try to put that picture behind, because if I try to kind of look at all of the different challenges that we're having and basically what we've been able to do over time, if we don't start to look at them with different lenses, if I ask all of you to do like this, now, what you will capture if you continue to move will probably be different. Now that's the way we want us to actually imagine this as we're trying to develop this particular fellowship program. We need to be able to reframe this whole thing, looking at challenges that have occurred in the course of managing different kinds of outbreaks that we might have out there.
In her address, Dr. Mary Adetinuke Boyd, Country Director, US-CDC Nigeria, highlighted the significance of the gathering by emphasizing the impact of recent infectious disease outbreaks that have affected multiple countries in the region, such as Ebola, Marburg, measles, cholera, SARS, and anthrax.
When these occur, regardless of which country you're in, it upends our collective sense of security.
She revealed that Nigeria had recently completed its second joint external evaluation, resulting in a 15-point improvement in the overall score from 2017 to 2023, with the point of entry section moving from yellow to green.
I'm happy to report that Nigeria recently completed its second JEE, and the overall score improved by 15 points in 2023 compared to 2017. And the points of entry section evaluation actually moved from yellow to green.
However, she acknowledged that there's still much work to be done both in Nigeria and the wider sub-region.
So we're bringing all of the stakeholders together. Let us reframe, let us look at all of the challenges. Now, when you finish looking at that, it is based on the finding from this kind of engagement that you reframe, that you now use to reimagine and look for solutions. You apply human-centered design into this, a client-centered design into this. You approach it from the solutions that you're going to be getting from people, which you cut across the communities, the national as well as international level. Now, when you package all of these solutions together, you can now use that to actually resolve it.
The NCDC, yes, plays a coordinating role in meeting IHR obligations, plays a coordinating role of emergency preparedness and response, but public health emergencies can occur anywhere, or typically we start off in communities. What this means is that we need everybody from community level to local government to state and national level to respond to outbreaks. This is why health security is not just a national government problem or a Ministry of Health problem or an NCDC problem. National health security requires an all of government response, an all of population response, and by extension, we need everybody that is involved to play their roles.
All of us will feel that we've done enough when lives are saved, right? When lives are preserved. I will say that while a lot has been done, there's still a ways to go. So there are some objective measures out there that tell us that we are improving. For example, there recently was the WHO completed joint external evaluation. In 2017, Nigeria had a score of 39%. In 2023, Nigeria got a score of 54%. And if you look at the breakdown of that evaluation, there's some areas that Nigeria has really moved from yellow to green, those are very, very positive signs. It means that the work that the Nigerian government, with the support of international donors, have done is making progress. But there's still some ways to go, which is why it's so important that we have fellowships like this, because these types of fellowships help us institutionalize and systematize the kind of work that we're doing, and not only in Nigeria, but across the region, and not only in healthcare setting, but across multi-sectoral response, because we all know that that is crucial if we're going to be successful in preserving lives.